Hello, I'm Angela Goodridge, and I am one of your medical assistant training instructors. And today we are starting on week one's content. And week one's content has quite a few areas that we're going to go over this week. And this week we're going to look at the role of the medical assistant. The medical assistant, we're going to explain what the medical assistant does in the clinical setting. We are going to describe different healthcare settings where you will find the medical assistant working in a doctor's office, in a nursing home. Sometimes you'll find a medical assistant at the desk, in the nursing home, in the hospital, and doctor's offices. Of course, many different kinds of doctor's offices. We'll talk about that during the week. This week, you will learn about the various members of the healthcare team as well. You would understand the role of delegation and your scope of practice. This will all be covered in Chapter 1. Also, we'll talk about professionalism in the workplace, and we'll discuss many different professional behaviors that you will come across as you work as a medical assistant. We will also talk about the certification process when you become a medical assistant certified nationally. In Chapter 2, we will talk about legal and ethical issues. We'll define the terms of law and ethics and list examples of legal and ethical behaviors. Also, we will explain patients' rights. Patients have rights in hospitals, nursing homes, doctor's offices. Anywhere you encounter a patient, you will also encounter the rights of patients. Rights of patients are very important. We will also, in Chapter 2, Week 1, discuss HIPAA, HIPAA, and discuss ways to protect the patient's privacy. We would also discuss common legal concepts and responsibilities in healthcare. In Chapter 2, we will also discuss some common legal concepts and responsibilities in the healthcare system. Not only will we discuss that, but we will discuss consent, informed consent. And then we will discuss mandatory reporting requirements. As healthcare professionals, that becomes one of our responsibilities. We'll also discuss incident reports. As you know, incidents occur quite often in healthcare, and we want to advise you, inform you, instruct you on the various methods and steps for recording and reporting incidents. In Chapter 3 of Week 1, for Week 1, we will discuss communication. As you know, communication is vastly important, and communication has quite a few implications as far as diversity and culture is concerned. We will define communication and the various aspects or modules of communication. We will explain verbal and nonverbal communication, different barriers to communication, and we will define diversity and understand the importance of responding to diversity without bias. After all, we must be able to serve all the patients that we come into contact with, regardless of their culture or different identities. We would list guidelines for communicating well with patients. Also, we would list ways to communicate accurately and explain how to develop effective interpersonal relationships. We would also, in Chapter 3, discuss and explain objective and subjective information and describe how to observe and report such information accurately. Also, in Chapter 3 for Week 1, we will explain how to communicate with other members of the healthcare team, and hopefully we'll have a little fun time doing that in our clinical settings and our lab settings. Also, for Chapter 4, which is going to be here in Week 1, we will talk about psychology and the human needs and development. As you know, we will identify basic human needs and describe holistic care. We will describe the stages of growth and development and identify common disorders in each stage. We will explain developmental disabilities as well as intellectual disabilities. We will identify characteristics of mental health and explain the connections between mental health and physical wellness. We will define stress and some of the stressors and discuss the psychological effect of stress. You will know that stress bears an impact on yourself as a medical assistant as well as the clients. We will also list and identify some common defense mechanisms. We will list the signs of substance abuse and discuss other addiction disorders. We will describe causes and types of mental health disorders and discuss psychological effects of chronic and serious illnesses. We would also define the psychological effect of chronic and serious illnesses, and we will try to understand end-of-life concerns and stages of grief. So these are the main topics that we will discuss in week 1. Week 1 is week 1 is going to be all lectures, and there are going to be 2 asynchronous sessions where you will continue your reading and testing in week 1. You will have tests on chapter 1, 2, and 3, and we will spend approximately 12 hours, 2 6-hour sessions asynchronously in continuation of reading your chapters 1, 2, and 3, and answering questions that will be also in your online class. That's it for now. Thank you very much for listening on the content for week 1.